Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine. And today we'll start with regional injuries. In today's video, we'll discuss about regional injury to the scalp and face. Regional injuries comprise of injuries to various anatomical regions of the body which have medical significance. So correct interpretation of these injuries is very vital for reconstruction of events, mainly the events like road traffic accidents or in case of assault. Any injuries with regional injuries like injury to the head, injury to the chest regions will tell the cause of death. Injuries includes injury to the head, face, neck, spinal cord, chest, abdomen, muscles, bones, or joints. Now coming to head injury, by National Advisory on Neurological Disease and Stroke Council, head injury is defined as a morbid state resulting from gross or subtle changes in the scalp, skull, and or contents of the skull produced by mechanical force which directly or indirectly applied to the head. So by definition, any head injury is a morbid state. So morbid state will result from gross or subtle changes to the scalp, which is outermost covering of the head, then skull, or contents of the skull, which is mainly includes meninges, CSF, and brain, produced by mechanical force. So any mechanical force which may be directly applied to the head or indirectly applied to the head, results in the head injury. So this is the definition of head injury. This injury includes craniocerebral injury, trauma to the skull, brain, etc. Of all the regional injuries, injuries to the head and neck are the commonest and also have a very forensic importance because they are mainly fatal. Classification of head injury. It may be divided depending upon the involvement of the dura mater. It can be divided into closed head injury and open head injury. Dura mater, which is the outermost meningeal covering of the brain. In closed head injury, the dura mater is intact. So if the dura mater is intact, it is called as closed head injury. And if the dura mater is torn in cases like fractures, which may pierce the brain and tear apart the dura mater, it is called as open head injury. Depending on the involvement of gross anatomical structures, it may be scalp injury, facial injury, skull injury, injury to meninges, and brain injury. So this is we'll discuss based on this classification and divide the head injury into these injuries. Cause of head injury, it may be result due to road traffic accident, which is commonest, then assault where two or more people fight each other, or fall from the height. Blunt force trauma to the head with non-penetrating objects all from fall or head striking a flat surface or any firm object can produce closed head injuries. Mechanical force which produces brain injury usually produces injury to the scalp and fractures of the skull also. Many times there may be a minimal or a no head injury minimal visible, even then there is chances that there may be brain injury may be present. Now coming to scalp injuries. Scalp wounds are caused by falls, blows, sharp cutting instruments or discharge of any firearms. Scalp is which is the outermost covering of the head and is continuous with the skin of the face. And it has 5 layers. Outermost layer is the skin which continues with the face. Then below the skin is the connective tissue which is very dense and it adheres the skin to the glia aponeurotica. Glia aponeurotica, which is a deep fascia, which is pierced by emissary veins which connects the intracranial venous circulation. So this is the area where emissary veins connects the it has a connection with the intracranial venous circulation is present. Then below the galean aponeurotica is a loose connective tissue and is considered as a dangerous area of the scalp where blood gets accumulated usually. Then below that is the periosteum, which is the outermost covering of the skull, which is adherent to the skull. So coming to scalp injuries, first of all is first mechanical injury, which may be of abrasions. So abrasions are outermost epidermal injuries, but in scalp injury, brush abrasions are less common than in other sites because of the protective effect of the hairs. So because of presence of hairs, abrasions are very uncommon in the area of the head, which also tends to prevent or blur the pattern effect of the less severe impacts. So any impact or any abrasion is which very less commonly seen in the head. Next is the contusions, mechanically injury, blunt force trauma lead to injury is the contusions. In this, in superficial fascia, they appear as localized swelling due to dense fibrous tissue. So because the dense connective tissue is very dense. The scalp injuries are the contusions is very difficult to see, but contusions deep in the glia aponeurotica are diffuse on account of loose aponeurotic tissue and difficult to make out on examinations. So because of dense tissue plus below that is glia aponeurotica is loose, so blood usually accumulates in the glia aponeurotica. So because of these two reasons, contusions on the scalp is very difficult to appreciate or visually see. So to that, easiest way to detect scalp injury is by palpitations or by shaving in case if there is not visible. So it is a saying that scalp contusions are really only appreciated by feeling it. So contusions are commonest like whenever we bump the head on the tables, contusion results, and it's very it may not be seen but it is very felt, only felt. So these are images. There is contusions of the blood and shaved head which can see the contusion. During postmortem examinations, autopsy surgeons are able to visualize subcapsular or hemorrhages by reflecting the scalp. So sometimes the contusion may not be visible at all in postmortem examination. Only when the scalp is reflected, contusion may be appreciated because it may be spread below the aponeurotic area, aponeurotic area of the scalp. Next, blunt force trauma, that is the laceration. So they always resemble incised wound again because of connective tissue. So connective tissue adheres the skin to the below layers, and whenever there is a laceration, it tears the skin and splits the skin, resulting in the incised looking lacerations or split lacerations. Careful examination of the depths of the wound will reveal the bridging fibers with surrounding bands of abrasions. So this is the only indication that laceration. This is the injury is a laceration and not the incised wound. Many times laceration may form different shape like a stellate shape, linear shape, Y-shaped or crescentic shape may also be seen in lacerations. So this is the image of lacerations where the skin may be lifted apart or it may just look like an incised wound. Careful examination of the wound may show that bridging of the tissues may be seen. Next is the sharp weapon injuries. This is incised wound. They have clean cut margins. Hair bulbs are cleanly cut, so we can differentiate between incised wound and laceration based on that. Sometimes effusion of the blood over the top of the head or forehead may gravitate down the loose connective tissue, causing the black eye, which is also called as periorbital hematoma. So any injury to the skull, so it can gravitate from the forehead near the skull. Any injury to the face near the forehead, mainly the forehead, can gravitate and accumulate near the eyeballs, near the eyes, leading to black eye. So this is the image of the black eye where the blood has accumulated, and which may be because of result from the frontal trauma on the forehead, or it may be because of the internal hemorrhage on the eyes. Wounds on the scalp they bleed very freely because blood vessels in the fiber tissue which are superficial to glia medica are being held open once cut. So since the blood vessels are held by the connective tissue, dense fiber tissue, and since glia apneutica are held, whenever there is cut, they do not contract. So glia apneutica prevents the contraction of the blood vessels. Because of that, scalp injuries they bleed freely, and also they heal rapidly because of same reason, because there is a rich blood supply. Soft fluctuant centers of the scalp hematoma can masquerade as depressed skull fractures. Sometimes hematomas in the scalp may be misguided as a depressed fracture because it is very fluctuant because of it bleeds very freely. Medical legal importance of scalp injuries. Many times a scalp injury may be a only clue about deep-seated fatal trauma, and it can also be a help in establishing time-space injury. So many times just the outermost skin injury may be the only injury which can be seen. Only when autopsy is done we can appreciate that brain injury is also present. Scalp lacerations bleed extensively, may even result in death from exsanguinations. Scars which are produced by the lacerations they contain no hairs, so it leaves a permanent disfiguration of the face. If infected, they may also lead to transfer infection from the scalp to the brain because of connection with the emissary veins, leading to a fatal infection of the brain, meningitis or cerebritis. Then facial injuries. Coming to facial injuries, those are the scalp injuries. Now coming to facial injuries are usually prone to heavy bleedings as face is highly vascular part of the body. Wound on the face which are more than skin deep can cause disfiguration. Patent injuries in the face are mostly fatal, particularly the area where sense organs are present. Blindness is a common sequel of blows to the face as retina is usually affected, resulting in detachment of retina. So, usually, other than the organs, sense organs like eyes, ears, nose, mouth, anywhere in the injury in the face, they bleed profusely because of rich blood supply. And many injury, patent injuries to the fatal organs may lead to death also. So, facial injuries are divided based on the sense organs. Coming to injury to the eyes, so injury to eyes may be because of result from the blood from lacerated wound of the eyes, permanent injury to the cornea, eyes or lens because of some blunt trauma. There may be vitreous hemorrhage, detachment of retina, rupture of retina, traumatic cataract, sequelae of any injury, then penetrating injuries to the eyes or gouging out of eyes, then black eye that is pre-orbital hematoma which may result because of direct trauma to the eyes. The injury to the nose, commonest injury is the biting or cutting off of the nose, which may be because of out of enmity, vengeance, sexual jealousy, or suspicion of infidelity of a woman may be there. Then sharp pointed objects can also cause penetrating wound to the nose. Rarely concealed puncture wound through the nostrils may enter the brain, may also lead to brain hemorrhage. A blow to the head may cause nose bleeding, that is epistaxis, due to partial detachment of mucous membrane without any injury to the nose. Now, injury to the ears may be cut off or bitten off. A blow can cause rupture of tympanum leading to permanent deafness. Severe blow can also cause injury to the labyrinth. Injury to the lips, a blunt force trauma to the blow with fist or any blunt weapon can result into contusions or laceration of the lip. Sometimes lips are also cut in case of sexual jealousy. Injuries to the teeth, with violence there may be fractures or dislocation of the teeth with bleeding from the sockets, and contusion and laceration of the gums may be seen where the injuries are directly impacted on the face. The injury to facial bones, blunt force trauma includes blow with blunt weapons like stick, fist, etc., or fall from the height. Nasal bones, temporal bones, maxilla bones, malleolar bones, and mandibular bones are commonly fractured. Heavy blow on the jaw can drive the condyles against the base of the skull, producing fissure fracture in the skull. So, heavy blow on the side of the face can drive the condyles of the mandible into the skull, leading to fissure fracture. Rarely, these condyles may also driven through the base of the skull and penetrate the skull. Now, coming to medical importance of facial injuries. Common facial injuries include cutting nose, cutting of lips, cutting of ears, etc. Any injury resulting in permanent privation of eyesight, which may be of either eye, hearing of either ear, permanent privation of either ear, or fracture dislocation of tooth or disfiguration of face, all are considered as grievous hurt. So, grievous hurt comes under any injury to this privation of eye, privation of ear, disfiguration of face, or fracture dislocation of teeth, all considered as grievous hurt, comes under 320 IPC, and it is mainly punishable after 10 years. These are my references. Thank you.